Hi, I'm Dr. Kurt Woeller for the SIBO Mastery Course. Title of this short presentation is called Treatment of Small Intestine Bacterial Overgrowth. There are a number of different treatment options for small intestinal bacterial overgrowth, also called SIBO. Because the reason there's so many treatments is that there are so many potential causes of SIBO. SIBO can be triggered because of some type of infection, parasitic infection, a bacterial infection, even a viral infection. SIBO can occur from somebody taking proton pump inhibitors or acid blocking medication for acid reflux. It can be caused by Helicobacter pylori infection, which affects the stomach. It can occur because of some dysfunction in something called the ileocecal valve, the valve that separates the small intestine from the large intestine. Fungal overgrowth in the digestive system. Clostridia infections could be a trigger for SIBO as well. Things that cause a disruption along the surface lining of the small intestine that affect the output of digestive enzymes or the ability to absorb nutrients can be a causative factor as well. So it takes some investigative work to figure all that out and then apply appropriate treatment. The problem with conventional medical approaches for this condition is what they primarily will give is an antibiotic to just lower the level of bacteria in the small intestine, but they won't work on other factors. Other types of testing is important. We have to test for small intestinal bacterial overgrowth specifically through what's called breath testing. That's either using lactulose solution or a glucose solution to try to reveal elevated levels of hydrogen and methane gas. But SIBO doesn't occur just on its own, right? It's being caused by other things. So other testing comes into play. Again, looking for chronic infections, looking for maldigestion, looking for fungal toxins or food sensitivities, all can play a role in SIBO assessment. And so therefore, treatment is comprehensive. Why people fail so many times with regards to their SIBO intervention is because they're only focusing on one thing, reducing the bacterial load in the small intestine. But there's a high recurrence rate with SIBO, because if you don't work on other factors, there's a problem. So dietary intervention is absolutely critical. There's not one diet or one diet that fits every specific person. It's very unique in many cases, but dietary intervention is very, very important. Digestive system support is critically important. We have to work on stomach digestion as well as digestion within the small intestine. We have to work on motility. Many people with small intestinal bacterial overgrowth have poor intestinal motility, meaning that the food stuff and other debris in the digestive system doesn't move through the small intestine into the large intestine effectively. And that means we also have to work on elimination. A lot of what's left out of other SIBO programs is the failure to realize that the large intestine can play a role. If there's chronic constipation, if there's problems or imbalances within the small intestine, that can be a problem too. The liver and gallbladder are part of the intestinal system. Those need to be supported. The liver produces bile acids. Bile acids is critically important for proper digestion. So digestive system support is critical. Yes, we reduce intestinal bacteria. That can either be through antibiotics or botanicals. Both can work in the right circumstance. So that is critically important. What also is important is making sure that when we are decreasing bacterial levels in the small intestine, that there's something there to bind up the toxins. Die-off can be a significant component of SIBO and often a trigger for how people feel with regards to headaches or fatigue or body and joint pain. Once we're through that process, we need to do some things to restore normal gut health, right? It's an ongoing process. And then trying to prevent relapse. This goes back to the whole discussion about improving intestinal motility. So if you focus only on one step, and forget about the other steps, you're not going to get much success. Whether you're a practitioner working with patients or whether you're an individual who's seeking out this information for your own well-being. We incorporate all of this material and much more into our SIBO Mastery course. I'm Dr. Kurt Woeller. I've been an integrative and functional medicine physician for over 2 decades. I have a tremendous amount of experience in people with chronic health problems. I do lab advising for BioHealth Laboratory, do a lot of clinical education for Great Plains Laboratory. I'm the co-founder of Integrative Medicine Academy, which is an academy that provides online training courses designed for health practitioners, but the information is open really to anybody who's seeking to advance their knowledge with regards to complex health disorders. Dr. Tracy Trancatella, who is a naturopathic physician, years of experience in working with people with autoimmune and gastrointestinal problems, joins me in this course as well. She's also a co-founder of Integrative Medicine Academy. And so the SIBO Mastery course is an extensive online educational experience. The material is developed for health practitioners, but as I mentioned, anybody can take this course and gain access to this material. All of the courses have early bird discounts available. There are course exams. There's continuing education credits available as well for those who are seeking that. And there's always extended access to course material once the course is completed. For more information about the SIBO Mastery course, you can go to sibomasterycourse.com. If you have any questions, you can email us at sibomasterycourse@gmail.com. Again, this is Dr. Kurt Woeller for the SIBO Mastery course. Thank you.